Is there a direct connection between the levels of potassium in your body and the patterns your ECG shows? Welcome to our journey where we'll uncover the mysteries of ECG patterns in hypo to hyperkalemia. You may have wondered, how do changes in potassium levels affect the heart? Can I spot these changes on an ECG reading? And what's the difference between hypo and hyperkalemia on an ECG? Stick with us as we address all these questions and more. The normal range of potassium in blood is around 3.5 to 5.5. But what if they go rogue, hitting 6, 7.5, or even higher like 10, or skydiving down to 2, 1.5, or even less? As scary as it sounds, ECG changes are even scarier. And let me tell you, they're not for the faint of heart literally. Now let me show you how these changes manifest on an ECG as the potassium goes either all the way up or all the way down. Ready? All right, let's get started. When you have low potassium levels, also known as hypokalemia, defined as a serum potassium level less than 3.5 milliequivalents per liter, it can mess with the electrical activity in your heart, leading to what we call ECG changes. Here's what happens. The resting membrane potential, which is like the baseline electrical charge of your heart cells, increases. This can mess with a part of the heart called the Purkinje fibers, making them less responsive and more likely to fire off electrical signals when they're not supposed to, which is what we call spontaneous ectopics. And all these changes can show up as distinctive patterns on an ECG. When your potassium levels drop to 3 milliequivalents per liter or lower, you might start seeing some specific changes on your ECG. For instance, the T wave flattens out, the U wave becomes more prominent, and the amplitude and width of both the T wave and U wave become equal. You also see some other changes, like the ST segment getting depressed or flattened, or the R waves getting larger. The QRS complex gets wider, and the P wave gets taller and wider too. When your potassium levels drop even further, like to 2 milliequivalents per liter or lower, the changes in your ECG can get more pronounced. For instance, the U wave, which is normally smaller than the T wave, can start towering over it. And the QT interval, which measures how long it takes for your heart to fully relax and refill with blood after it contracts, can get prolonged, meaning your heart might take longer than usual to recover between beats. In really severe cases, when your potassium levels are less than 1 milliequivalent per liter, the U wave and T wave can actually merge together, making it hard to tell them apart. It's like if you had a bunch of kids wearing the same uniform, and you can't tell who's who anymore. I mean, the heart's trying to do its thing, but it's having a really hard time because it's all jumbled up. Take a look at this ECG, which shows the changes we just talked about in a patient with hypokalemia. You can see the U wave towering over the T wave and the QT interval stretching out, which are both signs that the heart's not quite happy with its potassium levels. Now, what if there is higher level of potassium in blood or hyperkalemia? When your potassium levels shoot up, like over 5.5 milliequivalents per liter, it can trigger some pretty noticeable changes on your ECG. And when it goes even higher, like over 6 milliequivalents per liter, things start getting real interesting. First off, the ST segment on the ECG disappears, kind of like it's playing hide and seek. Then, the T waves get all tall, narrow, and peaked, like little mountain peaks popping up on the screen. The QRS complex, which represents the electrical activity of your heart's ventricles, gets wider, almost like it's stretching out to take up more space. And the P waves, which show the activity of your heart's atria, get wider and flatter, like they're spreading out to make room for the chaos. But wait, it gets even wilder. When your potassium levels hit 7.5 milliequivalents per liter or higher, your heart might just decide to take a little break, with sinus arrest and the P waves disappearing altogether. It's like your heart saying, okay, I need a timeout. And in really extreme cases, when your potassium levels reach the stratosphere, like between 10 and 12 milliequivalents per liter, the QRS complex and the T wave can merge together, causing total chaos in the form of ventricular fibrillation or a systole. This image right here is a snapshot of what your ECG might look like if you've got hyperkalemia. You can see how the ST segment's gone, the T waves are all pointy, the QRS complex is super wide, and the P waves are just kind of hanging out there, wide and flat. Now, as a healthcare professional, how would you diagnose and manage such a critical condition? And what steps would you take to stabilize the patient's potassium levels and restore their heart's rhythm? Feeling overwhelmed by the complexities of potassium imbalances and their effects on your heart? Don't worry, we've got you covered. Check out our next video, where we dive deeper into how we can approach this condition to stabilize the potassium balance and restore the heart rhythm.